Listen to this podcast now
on the Red Apple Podcast Network. The Idea Gen Global Podcast with George Sifakis.
I'm George Sifakis. In a world overflowing with noise, there is one forum where the world's smartest voices connect, where visionaries sit at the same table as innovators, and great minds don't just talk, they act.
Download all of Red Apple Media's podcasts right now through your favorite podcast platform.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
The More Money Show with Steve Moore on the Red Apple Podcast Network.
Our next discussion is going to be with two healthcare experts, and we are going to ask them how we can make healthcare affordable again, because folks, the Affordable Care Act, aka Obamacare, did not make healthcare more affordable. It made it a lot more expensive, and it is bankrupting a lot of businesses and families. So we've got to find a way to provide the highest quality care with the lowest possible cost. That's what we want. And so I have two experts on healthcare, Joel White, who is just an amazing expert on healthcare, and my friend Phil Kerpen, who works with me at Unleash Prosperity. He also runs a group called American Commitment. And these guys have been working day by day on the healthcare issue. So gentlemen, thanks for joining. Joel, let's start with you. What our listeners want to hear is how we can make healthcare more affordable, but still get high quality of care. I don't think we're doing a very good job of that.
Well, thanks, Steve. I would agree with that. And the biggest reason is that we've completely decimated the free market.
Yeah.
What we've basically done is we've taken choice away from consumers. We've taken the money and given it to big companies instead of consumers. And then we made these policies very, very expensive and driven everyone to these very expensive policies. So
let me just interrupt you hold on, just because this is a really important point you're making, Joel. And one of it's just, I remark on this all the time on the show, but I want to remark on it with you and get your reaction. You know, if you buy groceries, if you buy an airline ticket, if you go to a hotel, whatever you buy, you always ask, hey, what's this going to cost? But we don't do that in healthcare. I mean, it's the most amazing thing. We don't ask people what the hospitals, we don't ask the physicians, we don't ask the clinics, we don't have to ask the drug companies, what is this going to cost me? It's almost like we don't have a functional price system.
Well, we don't. It's almost the only market where almost no one who's delivering the good or the service and any consumer who's demanding or buying the good or service, no one in that transaction actually knows what the price is, and they very rarely know what the quality is until after the service or the good is delivered. This is just absolutely crazy, and what it means is that no one is price or cost sensitive, which means our costs and our prices are higher.
So, great point. And, I'm going to throw it over to Phil. You know, Phil, Kerpen, one of my, mentors, in terms of economics was the great Phil Graham, who was an economist, also a senator from Texas. And he used to say, Phil, that if we bought groceries the way we buy medical care, he said, I would eat steak and lobster and have champagne every night.
It's actually a little bit even worse than that, Steve, because, You might not even have steak and lobster. You might be just you might just be paying through the nose for hamburger and whatever, because we also restrict supply dramatically, and we subsidize a lot on the demand side with healthcare. So we get a massive amount of tax dollars coming in and tax advantaged employer dollars. It all goes into this bureaucratized system. And then in many parts of the country, there's so much regulation that you can't even open a new hospital, can't even open a new clinic. And so the supply is constrained. The subsidies are massive. You've got no functional price system. And so not only are we paying a lot more than we should, but in many instances, you don't even have much choice, and you may not even have very high quality because of the lack of choice. And so we have a highly dysfunctional system on both the demand and the supply side.
So, a question for both of you. I'll start with you, Joel. So let's keep this very simple because, the healthcare system is mind-numbingly complex, and that's part of the problem. What are some of the 2 or 3 simple things that we could do? Because obviously Obamacare was a total disaster. It drove up prices, and incidentally, the prices are going up, and by a lot of the indicators, the quality of care is actually not improved, and in some cases it may have actually fallen. So just keep this very simple because it's so complicated. What are 2 or 3 things we could do that would make the system work better and give us better health outcomes at a lower cost?
Yeah, I'll give you 3.
Yeah.
The first thing we need to do is we need to have prices up front. We need to know what we're buying and how much it costs. And if the price isn't available up front, we shouldn't pay.
Yes. Amen. I love that. Okay. Number 2.
So that's one.
What's number 2? Yep.
Number 2, we need to empower consumers and families and businesses. And what I mean by that is Obamacare said you can only buy the most expensive plan in the market, and you can only use a subsidy on that plan.
Right.
So there's plans available in every market that are cheaper than Obamacare that might work better for a family. Let's give people the money, not send it to companies, and then let's flex up the market and say you get to choose.
Yeah.
So that's number 2.
Yeah.
That creates a market. There's competition. Prices come down. Number 3 is what Phil talked about, and that is the premiums we use buy insurance that then pays for or supposed to pay for services and drugs. And we've restricted the supply. So dramatically increase the supply of doctors, nurses.
So hold on. Let me I don't completely understand. I mean, I understand that, if you reduce the supply, you're going to get higher prices. How are we reducing the supply?
Oh, we have certificate of need laws that basically say you can't open a new clinic because the monopoly in the area shuts down the zoning and the approval board.
That's the stupidest thing I've ever heard. That would like be telling Burger King, sorry, we've already got a McDonald's here. You can't have does that make any sense?
That's what happens in healthcare. And no, it doesn't make any sense because politicians and bureaucrats are running this show.
Oh my God. Okay. Those are making me angry. They're great ideas. It's just making me angry that the system doesn't work. Phil, I want to hear your 3 ideas, but also I want to ask you an additional question, or make a point and then get your reaction to it. One of the problems is people pay for the healthcare in all sorts of different ways. So you've got a system where we pay for it as taxpayers because a lot of it is subsidized by the government. And then you have also employers pay the cost of the healthcare, but that means people get lower wages. So we act as if it's low cost, but we're really paying through the wazoo for healthcare.
Every week, the Payne family cuts straight to the real financial story.
The one question, Bob, everyone's asking is, are we in an artificial intelligence bubble? You've been through boom and bust. What do you think?
No hype, no myths. Just what actually matters to your money.
Does feel very similar to what we experienced in the 90s. Where are we, though? Are we in 1995, 1997, 1999?
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
In Walmart Sue time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego Flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Here's my 30-second story with Guinness. As soon as my sister and I get home for the holidays, we don't even unpack. We head straight to our pub. The bartender already knows our order, Guinness and fries. We laugh all night, catch up with old friends, and walk home with faces sore from smiling. It's one of my favorite nights of the year. That was my 30-second story with Guinness.
Guinness Draft Stout. Please enjoy responsibly. Imported by Diageo Beer Company, USA, New York, New York.
Yeah, we're paying, and a lot of that is a consequence of the way the tax laws are set up, because if you don't use money that came from an employer or through an HSA or from the government, you're using after-tax dollars, and so you're actually spending even more. And so we've got a system that's very complex in that way. One of the things I really liked in the bill that the House passed right before they left for the end of the year is they expanded what they call choice arrangements, which is a system where if an employer wants to, instead of just offering a couple of health plans, they can offer you the money that they would have put in the health plan into an account that the employee can then use to buy whatever health care makes sense for them. And
is that a health saving account, or what is that?
That's called a choice arrangement, and Joel probably has more of the details on that. But the idea is basically like a reimbursement arrangement. You put the money in, and the employee can then choose the health plan that they want from any option instead of just the ones that are on the employer system. So that type of arrangement could really benefit, in terms of maybe rationalizing a little bit the choices that people have. But, one of the ideas that I really want to see, and I think this is going to become even more important with the direct-to-consumer drug sales that the president just announced yesterday, is if you pay cash for drugs, or you pay cash for a doctor or anything else, it should count against your insurance deductible and out-of-pocket limit. And that way you're not locked into just their prices that they arranged if you can get a better price yourself.
And by the way, can I just stop you there? Because this is also something at the top of my list as well, Phil, and you're one of the people who educated me about this. But, if you were to go see, a doctor, and, my family, we have like a concierge doctor. We kind of operate out of the system because it's so mind-numbingly, and we just pay the doctor. Essentially, we just write him a check, and we don't even deal with the insurance companies and so on. And by the way, because we do that, he charges us less because we don't have all these middlemen. Yeah, but under a lot of plans that doesn't count against your deductible and your out of pocket. It might. It varies widely by plans, but it should count for everyone. I think that would be a huge improvement.
Yeah. Go ahead. First point, I would just say that the prices that the president announced yesterday are huge. Their price reductions are massive. The discounts that are going to be available to consumers through this cash pay channel, because you're going outside the insurance. And the thing that's really funny to me is all over X, there are videos of nurses calling up imaging facilities and saying, I've got a patient here. They've got insurance. How much is it to get an MRI? Oh, we don't know. Let's look that up. And, hour or two later, they say, it's $2,000. And then the nurse says, oh, I'm sorry, I made a mistake. This is actually an uninsured patient. They're going to pay cash. They say, oh, the price is $500. Mm-hmm. So you can actually get lower prices, lower costs if you pay cash. You don't use your insurance benefit. But to Phil's point, you need to make sure if you pay cash, that actually counts against your deductible and your out-of-pocket costs.
So the whole health insurance system is also corrupt. We've noted that the health insurance companies have made money hand over fist since the Obamacare subsidies came into play. And isn't it true, Phil, that the health insurance companies have been one of the main advocates on Capitol Hill, the biggest lobbyists for expanding all these government programs?
They want to keep the spigots open for sure, and if you look at their stocks, they've done very well. The shareholders have done extraordinarily well. These companies not only do they get the massive Obamacare subsidies, but these are the same companies that have the Medicare Advantage plans where they're upcoding everything and getting money from taxpayers that way. In many cases, they've got the Medicaid managed care contracts. And so we've got these enormous health insurance companies now that used to serve private markets. Now they get the vast majority of their revenue from government, and therefore they pour a huge amount of it back into lobbying as well. And I just want to add one thing on the MRI thing from the last question. One of the reasons that MRIs are, such a strangely structured market is doctors can't own MRI machines because Pete Stark put something in called the Stark laws that ban self-referrals. And so a doctor cannot have even a partial ownership in an MRI machine, or else he can't refer patients to it. By the way, but the hospital systems, they never refer anyone out for anything. So we've got a lot of asymmetries in our regulation.
So we just have a couple of minutes left. You guys are making great points. I'm talking to two of the great healthcare minds in the country in terms of how we pay for it and why it's so expensive. Joel White and my friend and colleague Phil Kerpen at Unleash Prosperity. So if the Republicans cave in on the Chucky Schumer demands on health care, and we just continue to expand these subsidies, I'll start with you, Phil, and then Joel. What's going to happen? It seems to me it's just going to be more of a worse system. Costs will continue to escalate. The quality of care will continue to decline.
Yeah, the worst thing they could do is the bill that Schumer wants, which is 3 more years of supersized Obamacare subsidies with literally zero reforms. And they don't do anything about, there's no income caps at the top and there's no minimum payment at the bottom. And there's no fraud. And there's no... Yeah,
there's no
fraud of any kind. It's crazy. Jail put out this report about all these dead people, all these tens of thousands of Social Security numbers, have multiple people using them. They found one Social Security number has 71 people using it the same year for Obamacare.
Unbelievable.
And then the Democrats say, we're not going to change a thing. We don't need to fix anything. So I think it would just be an absolutely atrocious signal. Now, if you had some kind of compromise where they did a partial extension with some guardrails and we actually got some other reforms, I'd consider whether it's worth it. But this idea of just extending it and fixing nothing, I just find insane.
Joel?
I think if Republicans cave and they extend the subsidies and agree with the Democrats, we'll be one step closer to a government-run healthcare.
Yeah, of course. And by the way, Joel, that's what they've always wanted, right? The left and a lot of the Democrats. Yeah. And so it's always, yeah, go ahead. Sorry.
That's why they want to pour so much money in the system because it makes the system more dysfunctional.
Yes.
So in 3 years, 2 years, if we put more money into an expensive system, will we have a more expensive system or a less expensive system? It'll be more expensive. It'll be more dysfunctional. And the calls for, just let the government run it will be even greater. So Republicans need to fight this.
Got a minute and a half left. I just got my notice. Our premiums on our health insurance are going to go up, Phil, by 11 or 12%. That's like 4 times the inflation rate.
I think what we're seeing in healthcare is very similar to what we've seen in higher education. You've just got massive subsidies coming in from the demand side, and you've got very limited supply continuity. There are high barriers to entry, and so what happens? The price goes up.
Yeah, that's what's happened. That's a great way to end this conversation. The two industries that are bankrupting our families are higher ed, the colleges and universities that keep increasing their tuition rates the more we subsidize it. And that's exactly what's happened in healthcare. Gentlemen, thank you very much. Have a wonderful Christmas. It's been a good conversation. We'll be right back, folks. This is the More Money Show, and this is WABC.
Thanks for listening to More Money with Steve Moore. You can hear More Money with Steve Moore Saturday afternoons at 1. If you like the podcast, share it with your friends and listen anytime at WABCRadio.com and download the WABC Radio app. Hit that subscribe button on all major podcast platforms. Plus, follow WABC on social on Instagram, TikTok, Facebook, and X. See you next time for a new episode so you never have to wonder,
what the heck is going on here?
Every week, the Payne family cuts straight to the real financial story.
The one question, Bob, everyone's asking is, are we in an artificial intelligence bubble? You've been through boom and bust. What do you think?
No hype, no myths. Just what actually matters to your money.
Does feel very similar to what we experienced in the 90s. Where are we, though? Are we in 1995, 1997, 1999?
Listen to the Pain Points of Wealth on the Red Apple Podcast Network.